Hey ladies, it's Girl Talk Tuesday. So pregnancy can be a very happy time in your life. At the same time, we want to ensure that you have a healthy pregnancy, and we want to tell you about some of the risks involved when you are pregnant. So today we are with Dr. Aspen Laneman. How are you, doctor?
Doing well. How are you?
I'm well, thank you. No, I want to talk about gestational diabetes because I know that every doctor checks for it at some point in the pregnancy.
Yes.
Why is that?
Gestational diabetes is a significant risk for all pregnancies. It affects between 2 and 10% of all pregnancies. Usually we check for it between 24 and 28 weeks. With women who have a significant risk factor or a history of gestational diabetes, we will check for it earlier in the first trimester as an attempt to find it earlier in the pregnancy.
Right. Now, who do you think is at risk for gestational diabetes?
Everyone is at risk who becomes pregnant because the placenta itself secretes hormones that can affect the way we process sugars and insulin. However, women who are at increased risk would be women who have a strong family history of diabetes, women who have a history of gestational diabetes in previous pregnancies, women who have had large babies in previous pregnancies, even if they were undiagnosed as diabetic in those pregnancies.
I see. Now, for women who are going into pregnancy and they're completely healthy, is there cases sometimes where you see healthy women get gestational diabetes?
Of course, yes.
Okay.
Most obstetricians do universal screening, which means that we will do a sugar challenge test between 24 and 28 weeks of your pregnancy and check your blood sugar after you have a sugar challenge and see how it is. If it's normal, then you're fine.
Okay, and so for somebody who's faced with gestational diabetes, what are the consequences?
If left untreated, the elevation in blood sugars can lead to extremely large babies, which can lead to problems with labor and delivery, including C-sections, birth injuries for mother and infant, problems with blood pressure, and other situations with preeclampsia towards the end of pregnancy, other significant health issues with kidney and liver disorders.
Okay. Now, is there any way going into a pregnancy we can avoid gestational diabetes or?
Going into any pregnancy in the best possible pre-pregnant health status is always going to be the strongest recommendation. So being at a healthy weight with healthy blood pressure obviously is going to give you the best chance for having a healthy pregnancy in general. Avoiding high sugar and high fat foods, so drinking skim milk instead of full fat milk. Red meat, only eating 1 or 2 servings a week. Just eating a normal, healthy, balanced diet is obviously good advice for everyone.
So ladies, there you have it, some wonderful notes of advice from Dr. Laneman over at the Institute for Women's Health.
And here's the information. If you would like to get in contact with the Institute for Women's Health, they're on Floyd Curl Drive. 614-1000 is the number, ifwh.org.
They have a ton of
is the
locations,
website.
too.
They do, and so many wonderful doctors.
They do.